So this is an infection caused by a type of staph bacteria which becomes resistant to many of the antibiotics used to treat aureus staphylococcus infections. So most of these MRSA infections occur in people who are in hospitals or other healthcare settings, such as nursing homes and dialysis centres. So when it does occur in these settings, this is known as healthcare associated MRSA or healthcare associated Methicillin-Resistant Staphylococcus aureus. And these infections are usually associated with invasive procedures or devices such as surgeries, intravenous tubing, or artificial joints. This can be spread by healthcare workers touching people with unclean hands or people touching unclean surfaces. So there's another type of MRSA infection which occurs in a wider community known as community-associated MRSA. So this is within healthy people. So this often begins as a painful skin boil. It's usually spread by skin-to-skin contact. So at-risk populations include groups such as high school wrestlers, childcare workers, and people who live in crowded conditions. So symptoms include staph skin infections. So they usually start as swollen, painful red bumps, which can look like pimples or spider bites. So the affected area can be warm to touch, full of pus or drainage, or accompanied by a fever. So these red bumps can quickly turn into deep, painful boils known as abscesses, which require surgical draining. Sometimes the bacteria remain confined to the skin. They can also burrow deep into the body, causing potentially life-threatening infections in bones, joints, surgical wounds, the bloodstream, heart valves, and lungs. So there are different varieties of S. aureus bacteria, commonly called staph, that exist. So these are normally found on the skin or in the nose of about 1/3 of the population. So the bacteria are generally harmless unless they enter the body through a cut or wound, and even then they usually only cause minor skin problems in healthy people. So MRSA is the methicillin-resistant one type. So this is as a result of unnecessary antibiotic use. So antibiotics have been previously prescribed for some reason for colds, flus, and other viral infections which don't respond to these drugs. So even when antibiotics are used appropriately, they contribute to the rise of drug-resistant bacteria because they don't destroy every germ they target. So bacteria live in an evolutionary fast track, so germs that survive treatment with one antibiotic soon learn to resist others. So there are different factors for getting this. So hospitalization is one, having an invasive medical device, residing in a long-term care facility. That's for the healthcare associated. For your community associated, participating in contact sports because it can easily spread, living in crowded or unsanitary conditions, and men having sex with men. And then also people with HIV infection and using illicit injected drugs. So there are complications that can occur. So these can affect your bloodstream, lungs, heart, bones, joints. Because the MRSA infection can resist the effects of many common biotics, so antibiotics are more difficult to treat. So to prevent it, wash your hands, keep your wounds covered, keep personal items personal, shower after athletic game or practices, and sanitize linens. So diagnosis will depend on blood, urine, body fluid samples, a sample swab taken from a wound. So doctors will diagnose this by looking for signs of drug-resistant bacteria. The sample is then sent to a lab where it's placed in additional nutrients that encourage bacterial growth. So that takes 48 hours for the bacteria to grow. Newer tests these days can ever detect Staphylococcus DNA in a matter of hours. So if S. aureus is detected in the ones above, like blood, urine, body fluid, then further tests are done to see which antibiotics kill the bacteria. And healthy people who are suspected of being carriers of methicillin-resistant Staphylococcus aureus, they have a swab of the nose or skin taken and tested. So treatment includes early identification and prompt treatment with wound care antibiotics, draining the fluid from the abscess, surgically removing affected tissue, and prescribing antibiotics that treat MRSA such as vancomycin, trimethoprim, sulfamethoxazole, and linolazide. So a final point I wanted to add in there was what switches the Staph aureus to the methicillin-resistant Staph aureus is what's known as cassette gene. So that's what's switched on, and that's how you get to that infection. For those of you interested at the molecular biology level. So that's the end of today's video. Just a wee short one on Methicillin-Resistant Staphylococcus aureus. Please like, share and subscribe, and hopefully see you in the next one.